The next person we're going to hear from is Erin Guerriero, who's a board certified lactation consultant and is a supervisor with the New York State Department of Health and Mental Hygiene. Erin?
So yes, I'm the supervisor for the lactation team for New Family Home Visits program, which is with the New York City Department of Health. So within our role, we have six IBCLCs, including myself. And the way the program works is our public health advisors receive clients through the birth registrar. They call the mothers and invite them to be a part of our program. And then we're able to offer lactation support to our breastfeeding mothers. We have a robust nursing team that comes in and educates on postpartum uh, challenges like, what to expect if you've had preeclampsia, risk factors, warning signs. We also have a social work team. And then our public health advisors working one-on-one with the families have messages that they give around safe sleep, breastfeeding, and safe formula prep. So that is the basics of our role, but we do beyond that. So one of the things that we do is we're trying to work with more community partners and kind of get out there and see what the challenges are with um, why we're getting so many of our families that aren't exclusively breastfeeding or aren't breastfeeding at all or wanting to relactate. So I'm not sure if you're familiar with the PRAMS data. PRAMS is the Pregnancy Risk Assessment Monitoring System. It's an ongoing population survey for mother experiences in New York. So when we looked at the data from 2017 to 2021, what we saw is at 8 weeks, we had a range of mothers throughout the city, 28 to 30%. 36% still breastfeeding exclusively, with the Bronx being at 28%. So definitely lower than the rest of the city. Brooklyn's next at 32%, and then Manhattan has the highest rate at 36%. And when we reach out to our mothers, which we last year in 2023, we had about 1,500 referrals, and we were able to engage with about 1,300 moms. But we're seeing them at 3 weeks, 4 weeks, 5 weeks plus postpartum. So a lot of the support that we're giving them as lactation consultants is reactive, right? They've already been feeding their baby. They've already they're past that beginning stage of establishing their milk supply. When we talk about baby friendly, the idea there is that moms go in and they are getting evidence-based support and education around breastfeeding. Um, Not, with also accepting that there are many feeding choices, right? Many feeding options. So we always want to respect that. But what we're finding is that a lot of these moms are not getting evidence-based information, baby-friendly hospital or not. What happens in maternal child care, unfortunately, is they get a lot of anecdotal and opinion-based information. And then they're making decisions that they're not truly informed on. So we really need to get to a space where no matter who you're speaking to, whether it be your postpartum nurse or your obstetrician or the nurse prenatally in the clinic or your pediatrician, where everything that you are told around infant feeding is evidence-based information and not based on anecdotal opinion, personal preference. And not to sway people in their decision, but because our mothers are wise and they need all of the information so that they can make the right decision for their families. So on the PRAMS data, another thing that we found is that 52% of mothers state that they stopped breastfeeding before they wanted to stop because either an actual not having enough milk or a perception of not having enough milk. What's interesting about that, if we have 52% of moms feeling like they didn't have enough milk, is that 95% of the population can establish a full milk supply and continue to go on to breastfeed their babies. Only about 5% of the population has a medical or anatomical reason where they may not be able to do that. So we shouldn't be having 52% of our moms not reaching their personal goals for breastfeeding. That means that we either didn't give them the right information or we didn't give them the right support. So we need to see where the challenge is. So one of the things we're doing on our team, which I welcome anyone that's on this call to come, is we're hosting a roundtable event in the Bronx um, on March 28th. And initially, this started out, we worked with, I'm not sure if you guys are familiar with the Birth Justice Defenders, but last year in 2023, we were invited to present to them breastfeeding basics, which we did. And we were able to provide that education in 3 languages, Spanish, Haitian Creole, and Mandarin. But it's us talking in front of people, right? And even though the presentation was well received, we don't know how useful it was. So this year, when we were asked to come back and give some education to our birth justice defenders, we said, well, let's do it a little different. Let's do it where, yes, they're learning from us. We're still going to bring our expertise, but we want to learn from them. So that's why we're doing the roundtable event. So at that event, we hope to have some of our birth justice defenders from the Bronx. We're also inviting pregnant moms, moms to be who maybe aren't pregnant yet but want to be, our postpartum moms, families. Families are invited to the event. The location, I'll have to get back to you. I don't have it off the top of my head, but holds 150 people. So we really want to get a bunch of people there so that we can share some breastfeeding information. But we also hope that more than half of that, we would like to be the community telling us about their experience so that we can see where the disconnect is. I can speak a little bit to the disconnect, which I did earlier with sharing that a lot of times families get anecdotal or opinion-based information because I myself was a neonatal ICU nurse for 18 years before coming into this role, 10 of which were at Morgan Stanley Children's Hospital, not quite in the Bronx, but almost there in Washington Heights. So I have been at the bedside and I have seen where, we're not doing right. We're not doing right by our families by giving them all the information. So I welcome questions about the event. I hope in the future, if it may be at your next meeting or another time, I can present more of our work and more of the statistics and data that we collect from the PRAMs. But oh, Charlene, you're so wonderful. So Charlene Ogbeni is on the call. She is one of our lactation consultants. So she has put the address up for the Bronx Roundtable event. I can also send the flyer over so that you are all welcome to share that in the community.
Erin, thank you very much. For somebody who just was alerted a day and a half ago about coming on and sharing with us, you provided us with great information.
Our focus right now is on the Bronx. So it's
Mhm,
fresh in my mind because we're planning this event and we hope of interest. So it's so interesting. I just want to share one more thing. When we
mhm.
first planned this event, it was going to be in another location holding about 30 people. And then I'm just learning more of the people out in the public health community. I've been in this role about 2 years. Shirley over Bronx Health Link and Lady Pam of the Bronx were able to get us this other location that holds 150. But of note, it is in the area of the Bronx with the highest maternal morbidity and mortality. So when the universe makes adjustments and makes things bigger and then plops it right there, I feel like that's there it's saying start here. So we hope to take this event, see where our successes are, and bring it all around the city because we want to hear from everyone and see what we can do to change